Good afternoon. I'm Dr. Azar. Welcome. Greetings of peace to you and all the other viewers here. Here we are at Shura TV discussing different topics that might be of interest to you. It's Tuesday today and third week of January. Today we are trying to discuss a little bit in terms of an update on what's going on with COVID-19 and treatments that you should be aware of. We see a lot of people getting infections and getting a lot of hospitalizations and a lot of people you hear about that are getting COVID. So we thought it would be important to kind of circle back and discuss some of the do's and don'ts possibly that are out there from different institutions like Harvard and Yale and Johns Hopkins. And each university and each research institution has a different flow sheet and flow chart on what to do if you get COVID. Plus, we have the anecdotal advice of a lot of naturopaths and as well as people that have experientially dealt with COVID, and we've kind of gathered all that information so that we can present to you all the information that's out there so that you and your doctor, if God forbid you face this issue and you do have a relative or a loved one with COVID, you can know how to navigate the system and what to do and what not to do to give ourselves the optimal chance of doing well. The good news is that, of course, we have the vaccine rollouts that are in the process with the new administration. I think today is their 7th day in office. So I think that they're trying to catch up with what had happened before, and they're trying to get these vaccines rolled out. And I think their goal is to get about 150 million vaccines out in the next 100 or so days. So in the next 3 to 3.5 months, the goal is to get 150 million vaccines out. Nonetheless, the other part of that equation is that, if you're 65 and over, if you're someone that has any type of comorbidities, you have underlying conditions, things like diabetes, heart disease, autoimmune disease, lupus, osteoarthritis, anything that you have that can exacerbate any type of lung disease, lung issues, asthma, pulmonary diseases, anything like that concurrently, or if you're obese, if you're about, 25, 30 pounds overweight, it's been shown that these people will have a tougher time with COVID. So it's important that you know where you stand. No reason to get alarmed. It's just planning like everything else. As we see the infections that have increased now, thank God it has dipped a little bit. We are looking for the numbers are decreasing in terms of the mortality and also the hospitalizations and ICU bed utilization, at least here in Southern California and across the U.S. We are getting better at handling COVID, and as long as the resources are there and at our disposal, then I think we can get a good grip on it. But in the meantime, be aware, wear your masks, keep social distancing, keep washing your hands, and outdoors, limit the outdoor interactions, especially with people that you don't know, they're strangers, you don't know where they've been or what they do or what disease they might have. So it's very important to keep that in mind. As you might have heard yesterday in California, Governor Newsom lifted the lockdown. So the reasons weren't listed immediately, but they said that things were trending for the better, and they lifted the lockdown. And a lot of the facilities that were testing for COVID are now becoming vaccinator sites. So it's important to utilize those facilities. It can be frustrating when you get online to register for an appointment. A lot of slots seem to be taken, but a lot of this is due to computer glitches as well. You just have to kind of refresh and be patient until a slot becomes available. So it's important to do that and not to lose your patience. There's a lot of people concurrently trying to register for the vaccines, so it's very important that you remain kind of consistent and persistent, and make sure that you get yourself and your loved ones, if you qualify at this point, which is 65 and over, and anybody that's a healthcare worker, or those that have underlying conditions that can be exacerbated with COVID-19. So getting back to COVID-19 now, a lot of people nowadays, because of the flu, they're feeling as if, even if they get the flu or they have sniffling and sneezing, they get worried. And of course, there is reason to be worried, but there's no reason to panic. A lot of the facilities here in Southern California, as well as across the US, have standardized treatments and protocols now for COVID-19. I was reading the Yale review, the Harvard review, and John Hopkins, those three. And, again, they all advise if you have mild symptoms that you're getting and you've tested positive for it, the best thing to do is if your oxygen saturation meaning the level of oxygen that's available to your body or that you have in measured through a pulse oximeter. A lot of people have those little pulse oximeters now, and they keep them and they monitor their O2, especially seniors. If it's stable and it's above 94, 95, there's nothing to worry about. They just try to do kind of symptomatic treatment at home. The majority of people that do get COVID, they do well, and they will, go through the symptoms at home while they're quarantining, and that's the major number of people that get infected. So just with rest, staying at home, eating a nice meal, keeping nutritionally sound, they can cope with COVID, provided they don't have any other underlying conditions. Some people take, they're on blood thinners, they take blood thinners, or, baby aspirins and things like that, just to keep everything flowing. The other thing that was mentioned in the literature was that, sleep is very important. If you're not getting enough sleep, your body doesn't have time to kind of boost the immune system and really, fight off the infection. So it's important that, you rest, you get your sleep, you eat well. Symptomatically, if you do have a fever, you can treat it with Tylenol. They prefer Tylenol. Although now they're saying that if you're someone that doesn't tolerate acetaminophen, which is Tylenol, then you could, use ibuprofen sparingly. There were some French doctors that were saying that there was reports out of France that, using ibuprofen exacerbates the COVID condition. But now, through different studies that they've seen, it doesn't have that much of an effect. So initially they say take Tylenol, but if for some reason you cannot take Tylenol, then it would be okay to sparingly take ibuprofen as well for your fevers and chills and aches and pains. But again, the first choice, they say that it should be Tylenol, which is over the counter and anyone can get. And it's always best to discuss this with your own personal physicians and your own group, if you're a Kaiser patient, which 1 in 4 patients in California are. You can call the Kaiser line. They have a nurse that'll guide you through it, and they'll tell you what to do and what not to do. And if you have other doctors, call your doctor's office and explain to them what's going on, and they'll advise you, and they'll kind of lead you through the process. That's very important. So that's basically it. If you're at home, you have very mild symptoms, that's what you do. Just rest, and it'll be good to take a multivitamin daily. It's very important. Vitamin D has been shown in a lot of reports and studies that it helps with coping with COVID and decreasing the effects. There was a couple of studies on that, on vitamin D. So vitamin D is something that you can take up to 1,000 international units per day if you're deficient, and if you're not, just take the regular 500 to 900 that it's recommended on the supplement bottles that you get. Also, for some severe cases, they're treating them with IV vitamin C. There was a couple of studies that were treating them with vitamin C, and that also helps with coping and boosting the immune system. So that's important. So the best way you can get vitamin C is just through citric, vegetables and fruits. So you can take your mandarins, your oranges, all these things that have vitamin C, and really kind of keep up with the nutrition. Or the other thing you can do is, if you can't take a lot of raw vegetables and fruits, you can juice them. If you can juice them, you'll get all the nutrient contents without the fiber and without all the heaviness that some people experience with vegetables and fruits. So that's another way you can get all the nutrients that you need. So vitamin D, vitamin C, zinc, magnesium. So the best thing is to have a multivitamin and keep it up. And there was also some reports that we read on melatonin. Melatonin does have a positive effect on COVID outcomes. So it's good to take that as well in terms of on a daily regimen if you do have COVID and you're at home. So, vitamin A, vitamin D, vitamin C, zinc, magnesium, all this is good. And the most important thing is to keep hydrated. You don't want to be dehydrated. And also it's important, as mentioned in the beginning, to get enough sleep, to get enough rest, because that's the key. You want your body to recover. And, you have symptomatic treatment with acetaminophen or ibuprofen to keep down your fever. And if you're an asthmatic and you have it, you have to be a little more careful and watch your oxygen saturation and make sure that you keep your lungs clear and take your inhalers and medication on the regular intervals that are recommended. So that's very important to keep in mind. And, other than that, nutrition is best. Keep the best nutrition. Get 3 square meals a day. Eat your fruits and vegetables, and that's for the mild cases. If, for example, if the oxygen saturation is low and you're having problems breathing, one other thing to mention. If you do have, access to your doctor and you have a good communication with them, there's also people who get a little bit, if you have an underlying condition or you're older, they have what's known as the monoclonal antibody treatments. The same thing that President Trump had gotten. They have that available in certain doses, and they make that available. Not most, we'll say about 60 to 70% of the hospitals have access to that infusion therapy, and they can recommend it, but you have to let them know, and you have to kind of, discuss it with your doctor to see if they can recommend that for you. In short, it's called BAM infusion. Again, BAM infusion. If you can ask for that, they do that in an outpatient setting at either an urgent care or an infusion center. And that shows a 10 to 15% relief and decrease in chances of getting hospitalized for serious intervention. So that's important. The BAM infusion is something you can ask for if you're moderate to, bordering on getting into a hospital, or you're feeling the shortness of breath. It's important to ask for that and kind of be proactive in your care. Again, it's called BAM infusion, and they've released, I think, 300,000 doses of that to different hospitals in and around the U.S. In Southern California, here in Orange County. I know that Hoag has it, Mission in Saddleback, and I think Anaheim Regional possibly has it as well. Just check with your hospital, just check with your doctor. They'll know where, and there's a website that you can go. If you just Google BAM infusion, they'll list all the hospitals that have been given the means and the products and the medications to provide this type of infusion. And that has also proven to be, efficacious in preventing you from getting severe cases of COVID or get on a ventilator and things like that. So those are some of the things that are out and about, and they've been researched. And then, if you're in the hospital, they use remdesivir, and that's a medication that has now been researched thoroughly, and it's given, and the hospital usually has a flow chart, and they'll take care of you based on your symptoms that you're presenting. But it's important always to, be active with the hospital and kind of have someone advocating for you because of the sheer amount of people that now have COVID and are in hospitals. So, you don't want to get forgotten that, as we know, the system is overwhelmed, and it has been for a while. And until the system kind of, adjusts for that, and things are, progressing for the better, you need to have some type of advocacy for yourself. Have your doctor call in, your primary care doctor, or someone from the clinic to check on you. Or if you know a family or friend who's a physician, they can call in and discuss with your doctor what's going on, so that you at least have some type of advocacy, so that everything is being done correctly for you. So that because it's very important when you initially go into that hospital and they do that assessment on you, that they start you on the right therapy and they get the proper history on you. It's very important. I think and you as a patient and whoever your loved ones are that would take you in, they should know exactly what's going on with you in terms of your past medical history, the medications you're on, all that information. It's very important because it's counterintuitive that because nowadays, of course, people can't visit. There's nobody on site. So you have to have that plan. God forbid, if something happens, who will advocate for you while you are in hospital? You should have that, and you should discuss that if you feel that your medical history is not known to people around you. It's important to talk to someone about that, so that God forbid, if you are hospitalized, that they can call in and check on you and make sure that all the correct information is there for you. The other thing that other medication that they've been given now for the last 9 to 10 months is dexamethasone, which is the steroid. And the reason they give that is because they want to control the body's own, what they used to call the cascading system, or the immune cascade, where you get a lot of quick reactions, and the immune system of our own bodies exacerbates the COVID-19 condition. So they'll give you dexamethasone, and all the hospitals are aware of this, and they'll do that, and all the doctors know. So that's something that they're using regularly as well. Furthermore, I think it's important that if, for example, you do have a loved one in the hospital, it's important to really, keep that connection with them if they're not on a ventilator, obviously. You can FaceTime them, talk to them, and keep in close contact, and letting them know that things are progressing and people are taken care of. We get a lot of friends and family and people like that call, and they've been in hospital and they kind of don't know what's going on in terms of, from the outside world, their loved ones are, kind of shocked and scared. But it's important to kind of put that behind you and actually, if you do have a loved one or someone that's in hospital with COVID, it's important that you call them and FaceTime them and show them that, you're concerned and you're there for them, especially if you're designated as one of the people that, knows about their medical condition, and you can actually help inform the doctors and the nurses about what's going on with him and what has gone on in the past. That's very important to do. So these are the things to keep in mind. Hopefully, as the numbers decrease as we move forward through the year and we get more people vaccinated, it's important to keep a positive mental attitude. It's very important to not, you get COVID, it's not the end of the world. There are treatments that are working, and there are people now that are, the majority of people survive. So it is there. That's a fact, and we see that. But unfortunately, because of the sheer numbers that we've seen, because of either the gatherings that we did in over New Year's and the holidays, there are some people that gather. Because of that, these numbers have increased in January so badly. And moving forward, we should see a decrease once this vaccine gets out to the broader community and public, and things will be looking on the bright side. But in the meantime, you have to remain vigilant. Don't let your guard down. Don't get complacent as the lockdowns are, being lifted, but still, going to different public areas with people you don't know and they're nearby. It's very tough to be comfortable and really protect oneself from getting it. Even if you wear the masks, that'll definitely help you. That'll decrease the chances, and also if you socially distance. But you should still try to minimize that. Still try to just go out for essential things, and don't feel like, okay, now that the governor has lifted the ban on outdoor gatherings, or the lockdown is lifted, now we can go ahead and do a big Super Bowl party or whatever that you have in mind. It's not really conducive to health right now. There's still a little bit a stretch to go, and within 3 to 4 months, hopefully we can get all this under us and get the vaccinations on top. And by the way, there was another issue that came up this morning was the variants. The variants that are the variants that are out there now. There was a report from South Africa and England that there's a new variant that's highly more susceptible and easily it enters the human body and attaches quicker and tighter, the virus itself. Fortunately, the Moderna vaccine did a press release that Moderna does still has an effective. It is effective against those variants, basically. So don't despair, and they will come up with boosters that will cover the various variants. So that's important to know. And with the vaccines, they'll definitely help you. The first dose gives you 60% or 50 to 60%. After the second dose, you're up to 90% plus. So it's very important to encourage people to get that. And as it is becoming available, and they are producing more here, and that's something where everybody doesn't have access to that. But here in the U.S., fortunately, there is access, but we just have to kind of get in the queue and get in the line and set up, especially our elders, our first-line responders, and then going to the general population after that. So those are things to keep in mind. If you have any further questions or concerns, you can always reach us here at Shure TV. You can send us a comment and we'll get back to you. And we'll try to endeavor to answer your questions and give you all the information that we have at our hand so that you're well informed. Knowledge is power. So if you have the knowledge, if you have the information, and you have the resources, then you can do the best thing for yourself and your loved ones, and kind of navigate through this COVID-19 maze as we have. And yes, we hear reports that things change as the science is evolving. And there's more information, more studies that are coming out about different treatment protocols and what's being utilized. But the hospital systems in general are, following those guidelines, and they're following the best practices that are available. So I think with that, we can end today's program. I thank you for being here, and hopefully we'll see you next week.